Turning back now to our coronavirus coverage, cases and demand for testing continues to soar, but a new CDC ruling on isolations is fueling a little bit of confusion. Officials reduced the number of quarantine days for those who have contracted or been exposed to COVID. Our Gabriela Vidal has been talking with local health leaders about the new ruling and if it changes when you should get tested. Gabby.
Sam, while hospitals across the St. Louis metro, including here at Barnes-Jewish, are getting ready for potential surges in hospitalizations as a result of the Christmas holiday and coming in with New Year's, there is some positive hope here that people who are asymptomatic after 5 days of isolation don't have to keep isolating as long as they continue to wear their masks. They're saying that this is a positive note, despite the fact that we're still seeing high transmissibility with cases of the Omicron variant.
We got a challenge in front of us.
While cases of the Omicron variant continue to rise in St. Louis, confusion may be setting in for residents as to why the CDC is loosening its COVID-19 quarantine policies to 5 days of isolation.
The data shows that by 5 days after, most of the transmission is minimized. Not all of it, which is why you need to wear a mask for the following 5 days. But for 5 days, that's when you're most likely to transmit the virus.
Dr. Maria Strand is the chief medical officer at SSM Health.
All of us, whether we have COVID or not, if we're ill, if we have symptoms of a viral infection, we should be staying home and not working.
With this new quarantine guidance in mind, if you are symptomatic, you should seek out testing as soon as possible. But for people who have been exposed and not showing symptoms, it might be worth waiting for you to get a test, especially with demand for rapid testing at an all-time high. Asymptomatic or mildly symptomatic residents should also avoid utilizing the emergency department or urgent cares for testing to save those resources for people who may need more immediate medical attention.
If you've had an exposure, then it's recommended that you test basically about 5 days after that.
The emergency departments are already overwhelmed with people who are looking to get tested.
Right now, any form of masking can help slow the spread, but some masks are being recommended more with greater transmissibility from this new variant.
I think people should be wearing at least surgical masks. So they're sometimes called procedure masks. You can buy them at all drugstores. They're the 3-ply woven masks that are used in hospitals.
The CDC also implemented new guidance for healthcare workers, which SSM Health tells me that they've begun rolling out today. That means that any healthcare worker who is COVID-19 positive but is asymptomatic can return to work after 7 days of isolation, and that number could be even further reduced if there are lower shortages in hospital staffing as well. Reporting live, Gabriela Vidal, News 4.